My name is Natasha Shredecke, and I'm a PGY1 community-based pharmacy resident at Wake Forest Baptist Health in Winston-Salem, North Carolina. My research project this year was the evaluation of patient and provider satisfaction of providing care in the home. Neither myself or my co-investigators have any conflicts of interest to disclose. Let's begin with my self-assessment question. How does the integral role of a pharmacist contribute to patient and provider satisfaction? To provide a little bit of background on my study site, Wake Forest Baptist Health has 5 campuses with 9 community and specialty pharmacy locations and a house call program that provides home-based primary care and transitional home visits. At Wake Forest Baptist Health, our Wake Forest House Call program involves home-based primary care and transitional home visits. Home-based primary care takes the place of a primary care provider for homebound patients, and transitional home visits help to bridge the gap between hospital discharge and first primary care provider follow-up for high-risk patients. Patient satisfaction is an important aspect to address because healthcare is moving away from a volume-driven model to a value-based care model. The number of patients who can be reached is no longer the sole metric being assessed, but the quality of the care they are receiving is becoming a main focus. Patient satisfaction about the care they receive is becoming a key driver for payment. One of last year's residents, Amy Stewart, created this screening tool to identify patients that would benefit the most from a pharmacist's involvement. This tool utilizes the Electronic Frailty Index score, the LACE Plus Index score, and high-risk medications that a patient is taking in order to categorize them into low, medium, or high-risk groups. My research question was, do medium and high-risk patients and their providers feel satisfied in their health care with the addition of a pharmacy resident to their home-based primary care and transitional home visit teams? This was a single-center, post-intervention study approved by the Wake Forest IRB and included all patients who had a home-based primary care visit or transitional home visit with a pharmacy resident between July 1, 2019 and February 1, 2020, and were categorized as medium or high-risk patients based on the screening tool I previously mentioned. The study also included all providers who were part of a home-based primary care visit or transitional home visit with a pharmacy resident between July 1, 2019 and February 1, 2020. The primary objective of this study was to assess patient and provider satisfaction after a pharmacy resident was included as part of their home-based primary care or transitional home visit team. Secondary objectives were to determine the amount of time required to prepare for the visits and time spent in the home, as well as to collect the number of medication-related interventions made during the visit. The primary endpoints were to determine patient satisfaction after having a pharmacy resident involved on the home-based primary care or transitional home visit team after implementation of a standardized procedure, and to assess provider satisfaction after completing a home-based primary care or transitional home visit with a pharmacy resident. Secondary endpoints were the number of interventions made by a pharmacy resident and the time spent preparing for a visit and time spent in the home. Overall, we identified 22 patients who were medium or high-risk patients and had been seen by a pharmacy resident between July 1, 2019 and February 1, 2020. Patients received a mailed-out survey with a prepaid envelope for return. If the mailed-out survey was not returned, a telephonic survey was used to follow up with the patient. Providers received a printed survey. All results were used for statistical analysis. In total, the patient satisfaction survey had 18 questions, with 5 of them being pharmacy-related. The other questions asked patients about satisfaction with the house calls program as a whole at Wake Forest. The first 2 pharmacy-related questions were yes, no, maybe questions. The last 3 pharmacy questions were answered on a Likert scale of 1 to 5, with 1 being very unsatisfied and 5 being very satisfied. The provider satisfaction survey consisted of 5 questions with all answers being on a Likert scale of 1 to 5, with 1 being strongly disagree and 5 being strongly agree. The mean age of the study population was 73 years old, with the majority of the population being female. Patients were on an average of 14 medications each and had an average of 6 comorbidities. Overall, we had 10 patients complete the survey. You can see that most patients were very satisfied with the medication-related suggestions given by the pharmacist, very satisfied with the pharmacist's knowledge of medications, and the addition of a pharmacist to their teams. Overall, most providers strongly agreed that they had adequate communication with the pharmacist, that the pharmacist allowed them to focus on other matters, and were satisfied with the addition of a pharmacist to their team. Providers also agreed that patients benefited from having a pharmacist on the team. Here you can see that about 40 medication-related interventions were made by the pharmacist during their visit. On average, pharmacists spent 33 minutes preparing for each visit and an average of 63 minutes in the home with the patient. Some limitations of this study are the small sample size. Patients that were seen by a pharmacist for a transitional home visit several months ago were likely to forget the encounter and answer the survey with the image of their community pharmacy in mind. There was a low survey response rate both via mail and telephone, and one provider was unable to be surveyed. In conclusion, providers were satisfied with the addition of a pharmacist to their team. Patients felt that the addition of a pharmacist to their team was beneficial, and pharmacists provided useful medication-related suggestions, and pharmacists were able to make several interventions when visiting patients in their homes. Some next steps were to have more standardized training documentation, repeat the study in a larger sample size with the surveys being mailed out to patients directly after a visit. These findings may help to prove the value of having a pharmacist as part of a home-based primary care and transitional home visit teams. To bring it all back to the self-assessment question, how does the integral role of a pharmacist contribute to patient and provider satisfaction? Pharmacists feel satisfied with the addition of a pharmacist to their healthcare team. Pharmacists help providers have more time to focus on other aspects of care, and this brings interprofessional practice right into the home of the patient. I would like to thank all my co-investigators for their help during this project. Again, my name is Natasha NStroedecke, and I'm a PGY1 community-based pharmacy resident at Wake Forest Baptist Health in Winston-Salem, North Carolina. Thank you for your time.